Dr. Cassie Gutierrez, and I am an associate professor of health sciences. I'm also currently the chair of the health sciences department.
I'm Dr. Megan Brady. I am an assistant professor in health sciences, and I'm the director of the experiential education program for health sciences students.
So my role within the college, I serve as the director of student affairs. So our office actually serves the health sciences program, the pharmacy program, the occupational therapy program, and our future athletic training program. I work most closely with our undergraduate health sciences students, kind of in an advising, academic planning role. I also teach their orientation courses throughout the academic year. And do some special programming and event planning related to graduation celebration, orientation, and those activities.
It was actually a pretty easy decision. I was a program director at another athletic training program, and really it was two things. Number one, Drake. It's already established health science program, the pharmacy program, the OT program. The chance to work with those types of programs and students, and then also just the Des Moines area is a great place to have an athletic training program and health science program.
I chose to come work at Drake for its reputation in high quality education across programs, particularly at the undergraduate level.
I think that I have a number of favorite things with regard to the health sciences department. I think that the health sciences program attracts students that are interested in a wide variety of career pathways, and I think that diversity really makes for a strong program as the students interact with each other. I'm also excited about the faculty that are involved in the health sciences program, their research, the diversity that they bring, and their commitment and engagement with students is a real strength of the program and really helps our students to be successful.
So my research, I have a handful of different projects kind of going on that kind of, I don't know, put it all into some kind of umbrella term. I look at I guess you want to call it the unintended consequences of kind of financial kind of decisions within healthcare. So some of my projects are looking at how changes to Medicaid and how well people can transfer their assets, how that impacts their decisions to use different types of long-term care. And a newer project looking at basically how much would pharmacy graduate students need to be paid extra to actually encourage them to go work in rural or underserved areas.
I have two lines of research. The first looks at light therapy or laser therapy. Think of it as photosynthesis for the human being. So really it's how does light help patients who have injuries or skin diseases recover quicker. The second line of research is the psychosocial aspects of injuries, really looking at how athletic trainers, coaches, and athletes interact following an injury to really make sure that that athlete gets the health care they need.
Well, first of all, if they're thinking about a health career in general, they've made the right decision. There are so many different types of health careers, so alongside that, just knowing they wanted to go into healthcare but not knowing exactly what they want to go into is okay. That's why we have faculty mentors guiding them, and that's why we have the Introduction to Healthcare Professions course, so they can help navigate and figure this out as they go through their time at Drake.
My advice is to take the time to explore the different healthcare options that there are, because there are so many, and find the one they're really interested in. Another note is take the time to make a study schedule for yourself. It's much easier to study for an exam for 2 weeks than it is for 2 hours cramming for it. You'll benefit yourself in multiple ways if you just make a schedule and stick to it.
College is kind of, people don't lie when they say it's like the most formative 4 years of your life, that it is important to try out new clubs or activities and kind of meet new people, right? If you're just focusing kind of on the books and the classwork, obviously that's important, but it's important to, again, kind of get outside your comfort zone, try other things and kind of learn more about kind of who you are and take some time to enjoy it.
I love to water ski, not big on the other water sports, but love to be on my boat and love to water ski. And that's something that my entire family likes to do, and so we spend a lot of our time, especially in the summers, doing that.
I'm the youngest of 9. I have 5 older brothers and 3 older sisters. I ran the Disney Marathon in 2016, and I can say the alphabet backwards.
Do you want to do it for us right now?
No.
I don't know if I have 3. I've also ran marathons, but not for a long time. I lived in Italy. Lived and worked in Italy for a couple years before moving back to the United States. And I met my husband the week I moved back from Italy at a country dance club called Cowboys.
That is a great answer.
Tried it. That's all right.
For incoming students.
Ooh, that's a good one. Give me a second to start it yet.
Okay.
So some say that Dr. Brady is the funniest health science professor. Dr. Gutierrez, do you agree?
The funniest, honestly, I don't know if you've ever seen Dr. Nishinsky, Dr. Hurtlebrink, and Dr. Brady all together in a room, but it is pretty hilarious. In fact, sometimes I schedule department meetings just because I need to laugh a little bit.
Oh. How do you feel about that, Dr. Brady?
A little embarrassed. That's good.